Knee arthroscopy is the technique which people commonly refer to as keyhole surgery. Through two tiny little incisions, we're able to get inside the knee joint with a camera and tools to look around the knee, producing a fantastic view of all the tissues. We can identify problems and we can deal with them surgically, all through minimally invasive, low trauma techniques. We perform knee arthroscopy in a very careful, standardised fashion. Initially, we make sure the patients have lots of analgesia, and in this case there will be an anaesthetic, which could be a general anaesthetic, which is the commonest, spinal or epidural, and very rarely under pure local anaesthesia. We make sure that the patient is carefully prepared on the table, the skin is painted with antibacterial solution and cleaned, the area is dressed and wrapped, and we often use a tourniquet on the leg. Through two tiny holes in the front of the knee, we introduce a camera and tools. We gently inflate the knee with fluid. It's a clear salt solution that enables us to look around the knee with high definition cameras which produce a fantastic view as if you're watching on your television. At that point we can identify the problem and then deal with this surgically. Depending on the level of invasiveness of the procedure, most cases only require two tiny incisions. At the end of the procedure, we wash out the knee very carefully and suck out any damaged debris or tissue. The wounds are then dressed with simple paper strips or simple stitches. We inject the knee with lots of local anaesthetic to make sure patients are pain-free. The vast majority of knee arthroscopy patients can walk out of hospital within a few hours of admission, and very few of them actually even require crutches. We're able to mobilise them and hopefully get them back to activity as quickly as possible. There are a very large number of procedures that can be performed with arthroscopic techniques within the knee. From the big pieces of surgery like ligament reconstruction, typically the anterior cruciate ligament, posterior cruciate ligament, or we can work on the cartilages, the menisci within the knee. Again, a very common procedure to trim torn cartilages or indeed to repair them by suturing them back together again. Then we look at tissues such as the joint surface, which is a different form of cartilage, and you can think of this as a non-stick surface. If this has been damaged, this can be smoothed off, or in places we'll even try and regenerate surface. Overall, however, there are many different procedures, from simple removal of loose pieces to the more complex reconstructive surgery. The advantage of performing them through the arthroscopic technique is that we minimise pain, minimise trauma, and ensure a quick recovery. Indeed, some of the procedures are performed more easily through an arthroscopic technique, and certainly they give us a fantastic visualisation of what's happening within the knee, allowing us to be very accurate with our surgery. The recovery from arthroscopic knee surgery very much depends upon the procedure that's been performed. It can be very simple, from removal of a loose piece or loose body within the knee, or simple meniscal surgery, for example a torn cartilage which is trimmed. In those cases we'd expect people to be back at work within 2 to 3 days. They would have to ice the knee, perform physiotherapy, and they'd be back to full activity level in about 6 to 8 weeks, including sports. For the more complex surgery, such as ligament reconstruction, then the recovery is a lot longer. The commonest will be the anterior cruciate ligament. In this case, I would expect most patients to walk back into the clinic at 2 weeks, coming off their crutches. At 6 weeks, they would walk normally. At 12 weeks, most will be at the stage where they could do some light jogging. And at 24 weeks, they start twisting, turning, and jumping. But full recovery actually takes 9 months. So as you can see, the recovery is very much dependent on the complexity of the procedure that is performed. Having said that, the results from arthroscopic anterior cruciate ligament surgery are fantastic, with a success rate of 90 to 95%. And it's certainly a very gratifying procedure to see patients getting back to their sports. I love it when they send me a photograph of them playing rugby, when they're skiing, playing hockey, or all of the other crazy sports they love to enjoy.